there's barriers at different levels, right? So one of them is something that I think we can control in some ways as providers and a system of care is that actual access to care, right? We know that in the US there's differences in who can access care, whether or not you have insurance or public insurance, or if you're someone who's undocumented. And so one of the things that the Step Learning Collaborative and Mindmap has been able to do here in Connecticut is guarantee anyone who meets criteria for first episode psychosis, regardless of their insurance status, to have access to care. So I think we've been able to start to overcome one of those barriers, which is just so exciting. And because I can't tell you how many times over the past couple of years I've been on the other side of that phone listening to a desperate parent trying to connect their young person to care. And I have to say, I'm sorry, we can't accept you into care because of where you live. You just don't live in the right town yet, or because of your insurance status. And so those are things that I feel like we are able to start to change, which is exciting and incredible. And I'm really grateful from the support that we have from the state of Connecticut, DEMIS, and DCF to be able to implement this. And then there's other things. There's still such a stigma, whether it's the individuals themselves feeling internalized stigma, whether it's family members having, beliefs about what psychosis is and misconceptions, or the peers around them, whatever, the individual's community is, their beliefs about what this illness is and what it isn't can significantly impact someone's willingness to connect to care. So, another barrier is just the stigma that communities face and families. And so a lot of that, I think, can stem from just a lack of understanding of what psychosis is and what it isn't. Worries that it's going to mean that someone isn't going to be functional for the rest of their lives, which we just know isn't true. Recovery is absolutely possible. I've seen it in my personal life, and I've seen it with so many of the young people I've worked with. They're doctors, lawyers, accountants, they have families, meaningful relationships. And those things don't have to determine success. It can be whatever it is for the individual, but for the community to understand that this doesn't have to be a death sentence. This absolutely is something that is treatable, and that treatment isn't scary. It often happens just in an outpatient office once or twice a week, connecting with a therapist or a psychiatrist and working on things that are important to the individual. Navigating the mental health system and the system in general it's a social puzzle. And there's, even though we're working on our little corner of the world of trying to improve access to care, we're trying to reach communities, there's still people we're not reaching. There's still folks that are misunderstood. And, and selfishly, in some ways, I think about my own children, and I hope that we can continue to make change by the time that they might be of the age where they might need to access the mental health system. And so I think there's still a lot of work to be done in a lot of areas. And so that keeps me up at night, but that also gets me up in the morning to keep going to work and keep pushing.